Now, laryngomalacia is a bit of a mouthful, but I'll break it down into very simple terms. Laryngo gives us a clue. It's about the larynx, which is the voice box, and malacia refers to basically what we would call it being weak and floppy. So laryngomalacia is a weak and floppy voice box, and it is a condition that presents in infancy. Usually the child is absolutely fine for the first few weeks, and then typically on average at around about week 6 they start to develop some noisy breathing. Now, the noisy breathing that they develop is not snoring. It's a very distinct noise. It's a noise that we call stridor. And stridor is a noise that's made from airway obstruction, but it's different level of obstruction to what snoring's made at. So snoring's all about nose and throat. And then lower down we have the voice box and we have the windpipe. So apart from laryngomalacia, you can also have the windpipes known as the tracheas. You can have tracheomalacia or tracheomalacia. And then lower down, the trachea breaks off into 2, which are called the bronchi. So you can even have bronchomalacia. But let's just stick with laryngomalacia. So laryngomalacia, they get, as I said, this noise called stridor, which is sort of like a noise as opposed to a snoring noise. Okay, so 2 different noises. And the most common cause of stridor is laryngomalacia. So when a little infant is presenting with the stridor noise, the most common diagnosis that gets made is laryngomalacia, just by virtue of the fact that it's the most likely. Now, the problem is it's not the only one.